So James, you've just been speaking to my colleague Dr. Carrie McRae about your knee. If you don't mind, I'd just like to go through some of those details again briefly with you, and then we'll go over to the examination couch and I'll examine your knee if that's okay, and then we'll talk about the plans for it.
Okay.
So you're 58 just now, and you're fit and well, and you have a problem with your knee. Which knee is it?
It's my right knee.
And this is the same one that had been a problem to you before, and it's had some surgery before, is that right?
Yes, about 12 years ago,
Yep.
I had a surgery to repair a tear in the cartilage.
Okay.
And since then it's been fine, but it's reoccurred. Whether it's the same area or not, I'm not sure.
Okay. And is there anything that you can think of that might have started this off again? Did you have a particular injury or?
Nothing that stands out. Probably wear and tear might be the thing. I play quite a lot of golf, and of course twisting and the movements in golf sometimes, I think might be causing some damage to the thing. That's when I noticed it most.
So it's gradually come on over time.
Over the summer.
Okay.
Yes.
And what problems does it cause you? I take it pain is the main problem?
Pain's the only problem. It doesn't cause any problems when I'm at rest or just walking normally, but anything that moves my right foot outwards, I notice the pain then. And sometimes I say when through the golf swing it can happen. I notice it then.
Does it click or jam or lock at all?
No, none of these. It's just a fairly sharp pain on the inside of my right knee.
Does it fill with fluid?
Not that I'm aware of.
And does it give way at all?
No, it's not.
And how often does it tend to bother you? Obviously when you're playing golf, anything else that tends to bring it on?
Just as I say, if I'm just catch it the wrong way perhaps, or just turn it outwards. Sometimes in bed, turning over and the cover's pressing on it, I'm slightly aware of it then, it can be there. But, at this point now, I'm probably noticing it more often, I'm more aware of it perhaps.
Are you taking any painkillers for your knee?
No, nothing at the moment.
Okay. Can I examine it?
Certainly, yes.
Let's get you over to the couch then.
Okay.
Okay, let me just examine your comfortable knee first. No problems as I move it backwards and forwards there. Obviously comes nice and straight. Can I bend it right? Tell me to stop if I hurt you. Good. Let me just examine around the sides of your knee here. Anything make you uncomfortable as I press?
Really?
No tender spots there. Good. Let me just pop your ankle under my arm. Let the whole leg go completely loose and floppy. That's perfect. So it's nice and stable. Then put it back down on the examination couch there. Let it go floppy again. Good. Okay, let's have a look at the sore one. It's a bit more swollen, isn't it?
Yes.
And it's a little warmer. You can see there's certainly some fluid in there. Any discomfort as I move your leg backwards and forwards? Leg comes nice and straight. Can I bend this one up now? You tell me to stop if I hurt you. Great. Just leave it halfway there. So the outer side is the more comfortable part, isn't it? Let's start here and work our way around there. Anything there make you jump at all? Back of the knees okay? And then coming around the inside, anything there make you uncomfortable?
About there, just as you're
pressing
you there.
Okay.
In there.
And all the way back.
That's fine now, it's just really on the bone.
Let your leg just go loose and floppy again. And back down on the couch. Just let it go loose again. Okay, now I just want to see how it feels as it moves backwards and forwards. If I just place my finger on that area that was sore, that's quite comfortable as I just move it smoothly. If I twist your foot at the same time, that just catches you there. What do you feel? Is there
within just a fairly sharpish pain within inside right knee.
Do you feel anything moving or clicking at all?
No, nothing. It's just.
Let's take it away. Much more comfortable going that way, isn't it?
Yes.
Okay, good. You can feel me touching both feet on the top and at the bottom there. Good, we're all done. Let me just let the couch down and we're going to have a look at your scan. Okay. So this is the MRI scan of the knee that you've just had done. It's showing us pictures as if we're standing to the side of you. So this is your kneecap here at the front, this is the back of the knee, this is your femur, the thigh bone, and the tibia here, the shin bone, and in between the two obviously is your knee joint. Now on the outer side of your knee, where you've been quite comfortable, we see quite normal looking menisci. These are the shock absorbing cartilages. So that's quite healthy on the outer side of your knee. And then if we move through the middle of the knee to the inner side where you're getting pain, we see that these are damaged. And there's some general wear and tear both in the back part of this cartilage and in the front. But in between the two, we see some additional fragments of cartilage. And those, I think, are the loose pieces that are causing you your pain. If we just look. This is now looking at your knee from the front. We can see that fluid in the knee that we discussed just now, examining you. And then again, you can see the difference between the cartilage on the outside of your knee, which looks quite healthy, and this one on the inside. It's rather smaller because someone's already been at it and taken part of it away, but the fragments that are, or the part that is left, is also itself torn with some loose fragments there. And so the plan for the surgery is to look inside, confirm that that is the case, and then just remove those torn loose fragments, with the intention being that if they're not moving around independently inside the knee, it will feel a lot more comfortable.
Okay.
You need to be aware that there is some generalized wear and tear in the knee, I think as a consequence just of mileage and of having had that cartilage operation in the past, and that some of your pain may be coming from that general wear and tear. I'm afraid that can't be fixed through a keyhole operation, and so you may have some degree of discomfort afterwards, but I'm hoping that the sharp intermittent pains you're getting from the loose fragments will be a lot better.
Yes.
Any questions about that?
No, that's quite clear. I've never been one to understand X-rays and things before, but pointed out now I do see the differences, so that's quite helpful.
It's good to see it in black and white, isn't it?
Well, that's right.
Fixes
Yes,
it in your mind.
it's amazing.
Good, okay.
Thank you.